K-tape, kinesio tape, the way I'm kind of always thinking about it more is therapeutic taping. It's stretchy elastic tape, and did everybody get the box? So go ahead and unpack those. We'll start with looking at this stuff. The brand you have is TheraBand, and the reason why this one is just good from an instructional standpoint is when I turn it over, it has this cool kind of reptile skin pattern on it with these hexagons. And the small hexagon, when the tape is stretched, and it shows you on the back, when the tape is stretched to the point that that hexagon looks uniform, that means that you've stretched the tape at a 25% amount of tension. If you make the big hexagon uniform, then you're at 50%. So it's a nice objective marker in terms of just trying to figure out how much stretch you're applying. Because typically, you can be really guessing as you're stretching this and then putting it on the skin and making it have a shape and all of that. So this is really good for learning. The other brands, if I'm going to tell you just right off the gate, the brand that I think is the best quality, it is the OG original KT tape brand. And that is the brand that was founded by Dr. Kase. And he was a Japanese chiropractor, I believe. This was developed in the 70s. And then steadily has just gotten more refined and more popular, especially when it was seen in the Olympics. But the KT tape brand, and you'll find it anywhere. You can find it at almost any Rite Aid, Walgreens, anywhere. You have options for just the original, kind of the classic, and then there's the sports ones, and those end up having a bit more rigidity. They feel a little bit tougher, and they're more waterproof. So when people are going to be more active, they're going to wear it for a few days, they're going to potentially sweat, and especially in exposure to water, the sport ones will hold up better. There's two tiers on the KT brand of sport, and then there's like an ultra sport one. One shows a sporty lady with sunglasses, and the other one actually shows a swimmer. So the ultra one is even like supposed to hold up better for waterproof. The factor with that, and we're going to start with just elements of things to be careful about with this, with stuff to be cautious about. It's the adhesive. How sensitive are people's skin related to this adhesive? So if anybody here has sensitive skin to the point where they've responded negatively to tapes and stuff like that, we can modulate how much you're getting it put on you, all that kind of stuff. That's just the concern you have to voice to people when you're putting this on them for the first time. That in the event that their skin becomes irritated, red, itchy, it's time to remove it. These are latex free. They try to make them as hypoallergenic as possible, but it doesn't change the fact that under certain conditions, either a person naturally has very sensitive skin, or there's other factors that maybe you just weren't even aware of at the time. Like you have to be careful if you have a lot of oils or other topical elements being included in the session. You don't necessarily, you want to be careful about putting the tape over an area that's had some kind of chemical, topical element applied, okay? So, first off, it's that. If it gets red, gets itchy, is irritating, you take it off. The best way to take it off is under running warm water or hot water. So if you can, you get it in the shower is the best one for me, as I can get like the edge lifted off and take it off. I'm not ultra hairy, but even for me, if it's on my forearms or especially like my lower legs, It applies fine for me. I'll show off. You know, I don't have a ton, but you can get the tape to stick on me. If it's thicker body hair, it's gonna be a hard time. It's not gonna stick very good, and taking it off is a much worse experience. So if a client has really thick body hair, then that becomes a factor of having to say, well, you know, if we want to do this in a future session, you're gonna have to do some trimming. You know, it could be just with a trimmer, it doesn't have to be the full shave kind of a thing. But that is an impediment, and it includes causing issues with taping closer to the back of the neck, that coming up to the hairline. Ideally, yes, for headaches and stuff, I could take this tape and follow the anatomy all the way up to the base of the skull. But that would only really make sense if I have a nice, you know, sheen with no hair to worry about. And so this lower neck hair, taping around the neck, that ends up being probably my biggest complication in taping for the neck, but there's hair in the way. So body hair, it's a factor. For us, we have a lot of advantages in applying this. When I learned all this, I went through the 3 steps that the KT taping world does, the 3 big workshops, weekend workshops, and got certified and all that. I am not an approved teacher of their techniques and stuff, so you do not need any additional certification to do this kind of taping. There's no certification or licensing related to therapeutic taping at all, including the more rigid athletic taping, okay? You're still stuck in restrictions like diagnosis and things like that, but you can certainly apply this and use it without any additional credential, okay? It's very safe. The thing to distinguish it from is it is not like athletic tape. Anybody that's been in sports or seen where they use tape to create a brace, all right? Or a sling, a brace. This is not like that. So you have to distinguish, this is not about, that's where I feel like it's a typo that I put in stability as this. It shouldn't be stability as the goal that we're working off of. So if you can, in your minds, eliminate that idea. That's an old think kind of thing that I was discounting, that I need to discount. It's more about when we tape around joints, it's more about helping more efficient movement, more coordinated movement. It can be that, and I'll get into the actual terminology about why this works, but the sensation of the tape can help a person feel that area of the body maybe with a bit more precision. And so everything from posture correction to better movement during rehab or exercise. The reason can be the tape is there, you're feeling the tape, and either it's a reminder to hold your body in a better orientation, or maybe you're getting some additional feedback in that area of your body. So as you're doing the movement, you can just get slightly better adjustments neurologically. Some people have varying responses to this. About half of the people that use this get the perception of a lot of benefit. And then there's another half of people where it just doesn't work for them the way it does for others. And that is just what it is. You have to manage your expectations, and that for some, it can be great. It can be a wonderful strategy for mobility, pain management, all that stuff. But then there will be others where they just don't feel like a lot has occurred. And then you just move on to something else. When I learned this, a lot of time was actually spent. I was the only massage therapist in any of these workshops. Everybody else was physical therapists and chiropractors. And they were having to spend a lot of time learning how to tape with clothing on the person and trying to find a way to navigate working along straps and stuff like that. Now, in those settings, sure, they could have a changing room where people get into shorts and all that good stuff. But we have the amazing value of already having a person on a table, pretty much except down to underwear, undressed. So with draping, we can get really good access to the entire body without having to finagle and worry about clothing being in our way. So it fits for us and how we can use it. The thing that we have to watch for with this is the lotion. That if the lotion is applied and resting on the skin, that oil is going to stop this from sticking good. So you have to then clean the area. You have to be cautious with skin again, but I mean, I've seen everything from just using alcohol. A topical solution, just like you clean before you get a shot or anything else, right? It's not that crazy, but guess you could use sanitizer, but then that can have a residue. It's not ideal. What we have in those spaces there, and what when we go over for practice, we have these towel cavities, the hot towel cavities, which have a shelf for hot wet towels and a shelf for the hot dry towels. And that makes this a much more pleasant experience, especially for the practitioner, if not also the person. Because in the treatment, then what we get is not only massage, but then this hot wet towel on the area that you can make feel like more massage, has a sensation quality to it, but then it cleans the area of the lotion, and you can take the dry hot towel, get it dried off. Might have to wait for a little bit of air dry, but then you can apply it. And then furthermore, when we're practicing applying this is a bit for if you don't want this to stick aggressively on your skin. If you see people apply and then they're rubbing it, what they're doing is creating friction to create heat to make the adhesive liquefy so that it becomes more evenly distributed on the surface and then sticks more uniformly to your skin. So when they're rubbing it, they're just heating it up to get it to stick really good. So if you don't want it to stick and you just want to practice, don't rub it today. What we have with those hot towels though, is it makes it really convenient to get it to stick because you just use the hot towel. You get the tape down and you rub the area down with the hot towel and blammo. It's so much better. So if you are regularly applying this and using it, and in general, I think the hot towel cavities are just a really nice thing to have. They're not particularly expensive. Those ones, I can't remember what the brand is, but if you look at those, they have been workhorses and never had a problem. I don't think. Not one has given up yet. So I think it's worth it. Get the simpler ones. Don't worry about the stuff that has UV lights and other stuff. If I really am suggesting anything, take a look at the ones that we have and go with that. You can get them on Amazon. Super easy. I had one that came damaged. I sent it back and it was an immediate return. Everything was fine. So I am a fan. Now, to get into the fun stuff. Now, one thing too, we have, this is just for convenience. You all have the boxes where this is a pre-cut version of the tape that comes, and they all pretty much, the pre-cuts usually come in these dimensions, about a foot, all that. And what's nice is that there's rounded edges here. So as I teach this, I'll show the process of cutting to round the edge. All that's really going to be about is that a sharp corner can get caught and rolls up and lifts more. So when you see people bothering to even, because if you can get these on big rolls that are not pre-cut, you have to cut them yourself to size. And then what's usually shown is to round the corners. So you bring out like your, good old arts and crafts days and just make snowflakes and all the times. So you pay a little bit more for the pre-cut. The pre-cut, since it's one size, sometimes you end up having to use two pieces that ends up being a little bit more than you need, or you have to cut it down and round a side and all that. So the convenience though is usually you can make this work pretty good for most areas. So if you want the convenience, this is a really good go-to of just getting the rolls of the pre-cut. If you want to think more from a financial, like thrifty standpoint, getting the big roll that's uncut, you get more tape for your money, but then you have to cut it. And then you either have the option to cut right there in the moment, which I got pretty good at, of just like measuring in the person's body, cutting what I needed, but that can be an annoying, more lengthy process. There's plenty of people that get the big rolls and then just pre-cut a bunch preemptively for their needs, and they just make a bunch of small ones, a bunch of medium-sized ones, a bunch of big ones. But it's like anything, that costs less, more labor. This costs more, less labor. There you go. Again, the brands, not too big of a difference, I believe, price-wise here. I do like this for as you're learning. The adhesive quality with this one is pretty comparable to the KT Tape Classic, the classic one. But the sport brand KT Tape, for me, was used much more often because of the sports setting where somebody was more likely to be sweating and or getting in and out of hydrotherapy related stuff. So I like the feel of the sport stuff for me. My skin doesn't respond strange to it. It holds better. It feels like it has a bit more tension and oomph to it, all of that. But this is your safer starting point. People that they're trying it for the first time, start with a classic, not sport version, and then go to the more aggressive ones. Spartan tape. Spartan tape is the best bulk brand for your money. If you were buying a lot, and for several people that are using it in one clinic, for example, Spartan tape, solid quality. One of my tests with all of this stuff was I would put it on and I would go in the saunas, and the cheap stuff that wasn't good would roll up almost immediately, and the good stuff would stay. So I did do the comparison. Spartan tape, great. Same thing though, it's like a classic, it's not the sport. So the other brands, there's other brands of like stretchy tape out there that aren't quite like this Kinesiology tape. The most popular one is rock tape. It's not more popular than Kinesiology tape, but rock tape is out there. That is really strong. It's like going from trying to think, like a masking tape to the gorilla tape. Like it's T-Rex gorilla tape. It's really got a lot more rigidity to it. So it does kind of sit in a middle ground between this and the athletic tape. The thing that I really preach caution about is that its adhesive is aggressive. So you have to be really careful with sensitive or thin skin, as it will take sun with it. Any of these where it's really aggressive, like adhesive, so you just have to be cautious with that. Somebody had asked me about taping for pregnancy, and they will use like this tape, and I'll try to show that process so that you have an awareness of it. The idea is you create a cradle. Like here's the belly. I'm going to try to use a piece of tape to lift the belly and tape it up to the ribs to create, some lift. But that skin here is already stretched, right? So when I tried it on Laura, my sister, she did like it. It felt good, but she had a tough time when she removed it of that area being irritated. So, yeah. So that's kind of the breakdown for the beginning of all this stuff. Now, what I'll do a quick blob on is just how and why this stuff works. So the mechanisms that it's probably working off of, let me just clear some of this, probably has more to do with, it can just be hyperstimulation analgesia. So analgesia, anybody know what that is? Analgesia, analgesics. I don't know if I'm spelling this right.
Pain relief?
Yeah, but not fixing anything, but it just creates a sense of pain relief. It relieves the discomfort, doesn't fix anything. Just makes you feel pain less, right? So analgesia with manual therapy, when we're using touch and sensation, we can go further and call it hyperstimulation analgesia. Hyper, a lot, stimulation, something. Touch can be just hold, can be rubbing, can be temperature, all of that. We have to admit on some level that all forms of sensation-related therapy, including manual therapy, massage, hydrotherapy, thermotherapy, all of them on some way probably are working off of a hyperstimulation analgesic process. So there's something about distracting the nervous system by giving it a different sensation to feel other than the pain. Now you can go a step further with that and go into actual gate control pain theory stuff, which with that, that is more of an explanation of how that process is occurring. But with gate control biofeedback stuff, cautious of my limited space of writing, but with that, call it gate control is part of this. Gate control related to pain. These probably are related to each other, but there's more in the gate control theory related to pain about how your body is processing sensory input and how that can also just function as a way of managing pain in general. So analgesics, it's a bit more of a basic way of saying, well, it covers up the pain for a while, but using sensory input, and that's what I'm gonna probably make room for that. Let me just put it in there and see if I need more sensory input. That's the easier way of talking about input. As we go down, all of these probably do correlate. Now, sensory input, because it's a thing on the skin, right? There's a sensation in your skin, and the tissue just under the skin, the superficial fascia, has all those receptors, all those sensory receptors related to thermoreception, pressure perception, pain perception, there's mechanoperception. A lot of that stuff is just under the skin, embedded in the skin, and or with other things related to mechanoreceptors and proprioceptors, maybe a bit more isolated around joints. Regardless, if there's a sensation being put into those sensory receptors, that's naturally going to be sending signals to the central nervous system. There's something happening here. I feel a rubbing sensation on my arm, and my body is aware of it. Thank goodness. If there is a nervous system issue related to nerve damage, paralysis, anything like that, then there's going to be a different response. Right? Because we're working off of sensory receptor input. Sensory input. You can go neural integration, neural sensory integration. Yeah. There's another term that kind of just, it's closely related to sensory input, but it's used in a lot of these, the studies out there related to pain tend to talk and think a lot about this gate control to secondary sensory input and how sensation either can distract pain by sending signals that just beat the pain signal like in a race. And they're both trying to cross the line, and the more acute, sudden new sensation will just win the race, and it gives the body a break from discomfort. Now, going further though, with the sensory input, we go into more of this category of thinking about mobility, posture, and coordination. Especially when we tape across joints, all right? maybe we're having a bigger effect on proprioceptors. So proprioception, I have just enough room. Proprio. I see. Right, there we go. Yeah. Clean up the C. There. Now, proprioception. Rather than just asking anybody to remember what that is. So it's always going to be just me explaining. So proprioception is, in a very basic way of explaining it, how all the parts of your body are aware of where they are in relation to each other and in relation to the environment, without you having to just look at the part of your body to know where it is and how far away it is. So it's something that you don't usually think about. It's something that ideally you don't have to think about. There have been cases of people that get, usually through trauma, the loss of proprioception, and the way that they have to manage even tasks like driving and walking, is they have to be looking at their body to have an awareness of where it is in order to control and coordinate it effectively. So things that affect proprioception, like alcohol. The test there is related to how well the body is coordinating and processing that mechanism of our nervous system. So the way that I can, without using my eyes, have an awareness of where my nose and my finger are, that's how we explain it. That's done through proprioception. But there's so many other things that are happening. The ability for your body to just coordinate self related to posture. I'm standing in this space, like little things. I'm walking through a kind of a tight environment and I'm being aware of not touching this and that. So many subtle things that are just happening under the surface that it's really cool. But if we break it down more specifically to movements at joints, which is where most movement occurs, right? So proprioceptors are more isolated there. Taping across these structures may influence the body's sense of proprioception. It's not only sensory input, it's sensory input related to movement. So as a person does movement, maybe they're just getting more feedback, and with that extra bit of information, they can maybe more efficiently feel how they're moving and move better. I am a fan of the way we used it a lot in the sports world was, there was some aspects of taping for fluid movement and other stuff. But if we were using it for movement, it was usually compounded with taking them into the weight room. So think like a physical therapy clinic or strength and conditioning kind of environments. If for the knee, for the firing pattern people out there, if somebody got a knee replacement and the physical therapist's goal is to strengthen a particular muscle, let's say it's vastus medialis, which is really a really important quad for knee extension, and a lot of time will get spent in rehab trying to strengthen that muscle using bands and all that. I could put tape on top of that muscle while telling the person our goal is to, when we do this exercise, to engage here. Now there's this extra bit of sensation, maybe helping function as a reminder and a cue that as they do this movement, they're getting a more isolated contraction of that particular muscle. So I think the tape does a better job when it's used with other therapies. That there is physical therapy and then tape, tape then physical therapy. Same thing with strength and conditioning. All of it with that intention of, one, maybe actually giving the nervous system some extra information so it can be more coordinated. But there's nothing wrong with also the sensation just acting as a reminder. Oh yeah, hold my shoulders back in a better orientation. oh yeah, when I do my squats and stuff, set my feet and try to activate here. There's nothing wrong with using just a sensory cue to remind you every time you do the movement to do it as good as possible. Same thing, in my opinion, related to posture. The benefits of this one right here, the shoulder one. New research has shown that actually there may be something to this one and versions of this in creating some space for the shoulder joint. The way I perceived it and learned it, it was more about correcting the orientation of the shoulder girdle so that the humerus, the head of the humerus, is just set in the socket better. But I mean, we're talking about posture ultimately, right? There's some way here of taping this. And when this worked good, when I had shoulder people, and there were a lot of shoulder people that had a lot of value with this kind of tape. Sometimes it was simpler, sometimes it was more complex. But I would explain the goal. You know, the goal is we want your shoulders rolled back and down. It's better posture. And now with that sensation, ideally they have that on their body, and as they're sitting, driving, going about their day, they have that to remind them to hold their shoulders in a better position. And if they do that, whatever it may be, movements at a particular joint or postural related things, if we can help cue a person to start holding their body by itself in a better orientation, we're getting them to strengthen those muscles, and ideally eventually they can just hold themselves there without the extra feedback, or through using massage or other things. That can be a way to help a person teach their own body to hold it in a better posture and orientation. So I like the idea of saying this is the goal, even if you just feel this and it reminds you, hey, that's great. The other facets of what this is working on related to a lot of it is this one, the idea of decompression and movement of the skin, the tension force of what it does to the skin, and what that means, especially for lymphatic fluid. And if there is any kind of swelling, edema, surface blood like with a bruise, all that stuff, this tape can just be magical related to that. Especially with acute stuff that you can't massage. You're not supposed to push on a bruise, because a bruise is usually where a really sudden bad push happened. So you can't compress what is a compression related injury. But you can use this tape to maybe help draw that fluid out. And like, thinking about the receptors just in the skin, under the skin, if we decrease the tension of the balloon, all those receptors aren't being squashed as much. So whether it be that moving the surface fluid out of there decompresses those receptors, that may be a part of managing the pain. So it can be we're moving surface fluid out of the way, and that will maybe mitigate pain. So you can talk about pain control if we're seeing some kind of stagnated fluid that related to the symptomatic area. Or it's just a good thing for lymph drain. It's really, really good for lymph drain, because now, and once we practice it, that's this one down here. I call it the quadrupus. So 4 tentacles, it's easier than making a bunch of small ones. I'll show there's lots of ways to cut the tape. You can get really fancy with it and let your inner artist out. Even the big straps will be doing lymph drain. It's just that the smaller strips like this with the tentacles, they are displacing that tension and then also moving the skin in between the tentacles. So between my fingers, as I move the skin back and forth, the skin between my fingers is also being moved, right? So with lymph drain, there shouldn't be as much tension put on the skin. It's only a little bit. is we're trying to just make it every time a person moves, the tape is pulling on the skin a little bit extra and helping move the lymphatic fluid exactly the way it normally would. Because that's how your body moves. Lymph is there's a series of ducts and channels, and with lymph and veins, it's the same. There are ducts that only open in one direction to let fluid go up toward the core of the body. When those start breaking down, that's a bad thing. But ideally what happens, they don't have a pump like the heart. The arteries use the pump of the heart to move the fluid with every contraction. They go boom and whoosh. But all the surface fluid, venous blood and lymphatic fluid, relies on the movement of your skin, which pulls on those little ducts, and when they get opened, that fluid can move. And or the pressure changes created with muscle contraction and joint movement. Those pressure changes, every time I contract my muscles, the tubes get squeezed a bit. So for veins, they use the muscle contraction and joint movement change to act as a way of opening those ducts and letting the fluid go. So especially for lymphatics, any kind of edema, anything, God, that's probably in the end, the most complex stuff to tape is the stuff around joints. It's the one that takes the most practice, but the one that has a ton of research behind it is this one. And you don't have to worry about going past joints, and even if you do, it's okay. It doesn't have a lot of tension. There's small strips of tape. It's really safe. You barely feel like there's anything on there. It's a wonderful thing. So where it ties in with massage so good is that all of this, let me backpedal real quick to the connective tissue part of it, fascia. Same principle with fascia. That extra tug on the skin is constantly encouraging those elastic fibers to stay elastic. And there is something there's a lot of research is showing that the body being stimulated to distribute fluid evenly across the tissues is very important. It can act as a lubricating agent so things can slip and slide. Either the skin and superficial fascia can slip and slide over the deep fascia just underneath of it. And then all those other tissues. 2 layers of muscle encased in deep fascia, they need some slip and slide. So that's usually hyaluronic acid. But that being evenly distributed, right? Like if anybody's used WD-40 on a hinge, you can't just, spray the hinge and say it's done. You spray the hinge and then move the hinge back and forth so that the fluid gets into all the surfaces that rub and make contact. So anything that encourages that is a really good thing. And usually with myofascial release, connective tissue release, scar tissue work, most of what we're probably working with is the superficial fascia. We will be helping distribute lubricating fluids for the deep fascia, but we're probably not having as much of an effect on the deep fascia in terms of like changing its shape and its elasticity. With a scar, when a scar forms, that is replaced tissue. It's there. The scar has filled in a space. It filled in a hole, just like I broke something. I broke a piece of wood and I used epoxy or something to glue it. But the glue is there and we need the glue there. The glue was used as a way to stitch and hold it all together. Ideally, our bodies replace tissue with the tissue that was originally there, but many times we'll just use dense connective tissue and fill in the space, and that is what scar tissue is. It's filling an area with dense connective tissue. Areas that get chronically inflamed, whatever they are, can start to densify, and what you end up with is densification. But fibrosis, you'll hear, but really what happens is what should have been more elastic becomes more and more rigid. The body keeps on thinking with chronic inflammatory processes. This may be an overly simple way of explaining it, but it keeps on trying to heal the area, keeps on trying to heal it and heal it and heal it. And as it keeps on healing it, it's laying down more collagen fibers as opposed to elastic fibers, and we end up with thicker tissue. But that's different than a scar. That's when people talk about like kind of adhesions and things like that. So we tend to use adhesions probably in the way that scientifically isn't defined as. Adhesions scientifically are much more aggressive, like fibrotic stickiness, as opposed to sometimes it's just a natural thing. You didn't move for a while, stuff gets stiff and tight, and after you work on it a little bit and move around, things free up and you're fine. Like that wasn't a permanent change, right? So a scar is a permanent change. Now, we want to keep the scar as pliable as possible, but then also all the tissue around it. All the tissue around it, the scar loves to pull stuff towards it. It's like an evil spider web where it's pulling it here, pulling it here, pulling it here, and everything is getting pulled toward the scar. So what you end up with is this has been replaced, but it's tugging on the healthy tissue around it. And we can help keep the healthy tissue around it pliable. And if we can teach the body to maybe sustain that, great. But tape over this, that now puts an additional tension force on the skin and the superficial fascia and the scar every time that person moves. Now, every time they move, they're getting that little tug on that scar and keeping it mobile. It's not really any fancier than that. So for any connective tissue, anything, areas that just are thick and tight for whatever reason, immobility, increased muscle tension, all kinds of stuff, because that'll just, everything compounds on some level. I don't have anything to point to, but I hurt my wrist. It gets swollen and inflamed as it heals. So there's fluid and it hurts and it's ouchy. I could use tape, massage, everything to just manage my discomfort while it heals. But while it's healing, the body's gonna tell this area not to move a lot. Let's say there's a hole that got ripped open in a tendon or some muscle or something. The body wants it to stay still so it can heal it as good as possible. Now, if it's still for a while, all those lubricating fluids aren't being distributed correctly, and the muscles will get stuck tight, the connective tissue will get stuck tight, and that's usually what we're looking at long-term with a compensation pattern. That after a while, I started with a bad boo-boo, but after the fluid is out, maybe I'm still stiff and everything's tight. And that's where massage can be so valuable, where we're usually working, finding stuff that's too tight, too short, not mobile enough, and encouraging it to be more mobile again, right? So we do our massage part, and then we put a piece of tape on it. Now we have the tape there to help keep the effect of the massage going for a few more days. So you may be able to extend the benefits of any therapy. This is how it gets used more often in physical therapy. Tends to be to do your exercises, and then there's taping put on, and the idea being that the tape helps encourage the body to keep whatever therapy going that you did. So especially with fluid movement and connective tissue pliability, fantastic, because it can be left on for days. So something I didn't cover, duration. I usually suggest probably not longer than like the 4 to 5 day mark. But if people are brave, no, I've totally seen people leave it on for over a week and they're fine. I'm like, kind of gross. So, now it can get washed, like you can trim it yourself. You know, I've stuck it on areas of my body and like it starts to peel up and I trim it. I usually just take it off and put a new piece on, but you know. But you can tell people you can leave it on for as long as is comfortable. You know, 3, 4, 5 days, great. And then suggestion, take it off in a nice warm shower. So usually it'll start to peel up at some point. And then if they really like it and they get good at it, then they can trim it themselves. So just the encouragement is don't cut yourself. So the other thing I would point out with, if you're doing this a lot, is getting medical grade scissors that have that little bump at the tip to help protect you from stabbing yourself or your client. So they're used in the medical industry and they're really convenient. I bought these thinking that they'd be good, but they're kind of crafting scissors, and they have that little bump so that I can set that on the skin and not worry that I'm gonna inadvertently get myself. However, with these, what I learned is you open them too wide. Because I'm conditioned with scissors, you know, you open them real wide and start cutting, right? These, you have to have them right here. So if you get stuck with using these today, don't open them all the way, about halfway, and then cut. But you can use any scissors, but if you're doing a lot of it, get the really nice scissors that'll hold up and that have the little protective bead at the end.
Trauma shears are also very, very sharp, so it's easy to cut through things.
Yes.
I have a few pair from
And thank
really
you, better
high
term,
company.
trauma shears. Yeah, yep.
Oh,
Yeah.
cutting through clothing and stuff.
Oh
Yeah.
yeah, well, we've had to cut
Yeah.
like really big things,
Yeah.
so they're super sharp, so it makes a clean cut, and they all have that big end on the bow.
The
They're
better the
really
cut,
long.
yeah, the better the sharpness. And also, you know, these are kind of short. A longer scissor type, when you're talking about something, is about 2 inches. It's just, you get a much cleaner.
I have a pair in my truck of actual trauma shears.
Oh, bro, hey, if you want to practice with them, okay, huzzah. So,
They're really nice.
so yeah, you're doing this a lot, get the good, because these are one-time investment things. That's where I encourage you to do things like that, the towel cabbie, even a cupping kit, like that Theragun one is really great. Quick thing on cupping. As far as the natural treatment on scar tissue and connective tissue, you're not gonna beat cupping. All right, cupping creates a kind of tension on the skin and the superficial fascia that we can't do, the tape can't do. If you really want the question of what is the best tool to use related to connective tissue work, it's cupping. Like, it's just get good at cupping if you want to work with scar tissue and stuff like that. You can't beat it. The only problem with the cups is sometimes they're hard to get on certain body areas. So that's where the tape could have additional value. Where the tape has the big win is it can sit there for days. And especially for swelling, edema, lymphatic fluid, anything, what's nice then is that can be sitting there, especially like for lower leg or whatever. And the homework of the person now is, you know, when you're sitting, make sure you're wiggling your foot a little bit. Anytime they're making their skin move at all, plus that tape, we're encouraging that lymphatic fluid movement. So, kind of gives the blueprint of how and why a lot of the stuff works. If I want to say where I think it has the most value, related to pain management, now that's why this one, on the chart, by the way, I just didn't have any more room on the body, okay? So I'll make sure I have a still on the video that people can look at, but it's in the book, all that kind of stuff. Any of these, like the pain one, the lymph drain one, you could apply those anywhere and everywhere, all right? If you're doing the lymphatic one, I'll talk more about that, but you're just thinking about the lymphatic system and how it's structured in the body. Here, the idea with anything, it's just if somebody had a hot spot, it's just an angry place. If we put lots of tape over top of that spot, we're maybe getting more and more of a lift. So this is getting close with multiple layers overlapping on one spot, more like a cupping action. Really lifting and decompressing that spot right where the center of the star is. That center point is getting lifted up as much as possible. So you may find somebody that has what kind of we'll call a hot spot. Maybe like there's a bit of like an area like superficial nerve damage. I've used it when I had any kind of ulnar nerve discomfort. A big piece of tape here. I mean, And I can be a pretty strong skeptic on a lot of stuff, and it was like, oh, no, that felt a lot better. Just creating a little bit of extra space for that superficial nerve. There's a superficial nerve on the lateral side of your feet. That can be a good way to use it. It's just a way to pull the skin up, thinking like a tape cup. So that's what that one is. Everybody always is like, why would I put it there? Like, not usually is somebody gonna point, it hurts right there. Like, there we need to encourage better breathing. So you could use that star shape anywhere. It's easy. The ones that we're gonna practice more are gonna be the more complicated joint ones. You know, we're gonna think about the easier stuff, which would be an elbow or a wrist. Those are the easiest. Then we get more complex with the feet, and then we get more complex with the knee, and then the most complex probably is the shoulder. So those will be the ones I demo when we practice. And then the one that we want to have as much fun with as possible will be cutting and doing the quadruples. Because that one, you can make them small, you can make them big, you can cover the whole body all over the place, right? And the idea there being that where the head is a smiley face. You're not doing it right if you don't give it a face. But the head drinks the water. It's going right through you. So you put the head near where the lymph nodes are. Wow. So you could, if somebody's leg was really swollen, I could surround their upper leg in quadruples and surround their lower leg with quadruples, and they're all facilitating moving it up, up, up. So the theory behind that is where the bigger piece of tape is, the smaller pieces are retracting toward that. So
there's some really cool images on Google too. Bruises with the quadrupus, if you want to look that up.
Thank you, yes.
Fascinating.
Well, not quadruples, just
Right.
KT tape for bruising.
Yeah.
I'd love to see. I don't know. but if you look up, and in general, resources. Thank you, Sarah. KT tape, Google Images, KT tape, YouTube, KT tape for wrist, KT tape for this. No, you can just make it up. There is no right way to do this. All right, but you can use those videos and those images as inspiration. And Sarah's absolutely right, especially for bruises. At one point I'll bring up images here on the TV because it is really cool to see what it does for a bad bruise. Oh, you're getting it hooked up? You're a good man if you can figure it out. So let me stop the video. We'll go to the next part